Hello and welcome to my channel. I'm your favorite medical microbiologist, Gwendolyn Halley. Today I'm going to teach you the new cure for high blood pressure, otherwise known as hypertension. Do you know that hypertension is known as a silent killer? Why is it known as the silent killer? Because the symptoms are sometimes not very physical or does not manifest in the life of the carrier or of the patient. Sometimes you can have someone who has hypertension or high blood pressure and they're living normal with no symptoms at all. They have no backache, no blurred vision, nothing, no bone problem, no chest ache, no nausea, nothing. They are just okay. But before we go into this, what causes high blood pressure? High blood pressure is caused when the blood in the vessels exert pressure, high pressure, on the walls of the arteries. Now, this pressure that is caused by the blood in the blood vessels can damage the brain, can damage the kidney, can damage different organs in the body, the lungs. And what can cause this pressure? What can cause pressure? That means what can cause the blood in the vessels to exert high pressure on the arteries, on the walls of the arteries. It could be anything. You could have a thyroid disease. You could have, even be pregnant. Drugs could cause it. You could be obese, it's a high intake of salt. You could even have a tumor in your body. There are many causes of high blood pressure. There are many causes of that. And sometimes you may just be taking regular drugs that are prescribed by the doctor. But in your body, it can cause this pressure on your arteries and destroy an organ. This is why it is very important that we should monitor our heart rate, we should monitor ourselves, and everybody should buy a blood rate, a device to measure your blood pressure at home. Now, when this pressure is exerted on the blood vessels and it exerts pressure on your heart, the brain, the kidney muscles, it can cause stroke. It can cause heart failure, organ failure. It can cause heart disease, kidney disease, heart attacks, and a lot more. Now, enough of this. I want to take you through how to prevent this. The first new cure for high blood pressure that a doctor in Greece came up with, scientifically proven, that a patient who sleeps for at least 40 minutes in the afternoon is most likely to get cured of high blood pressure. So make sure you take your rest in the afternoon. It will help you a lot. Point number 2. I would say know your family history, and it will help you to be more cautious. You can actually live your life happily, healthily, and safer if you're conscious of your family history. So you don't have these episodes or these extreme seizures or problems that may take your life. Next point is eat healthy. Don't eat canned food. Stay away from processed food. Eat a lot of vegetables, alkaline-based food particularly. And if you can get yourself some alkaline water to drink, that will help to maintain the pH of your internal body. That will help you so much. Next point, exercise. Exercise regularly will keep you living longer and healthier. If you're obese, do as much as possible to lose weight, because you may not live for long. with the fat in your body and the pressure the blood is exerting on the blood in the vessels is exerting on your arteries, it's not going to be good for you. It's not. If you're overweight, you need to check your BMI, lose weight, because weight, if your BMI is so high, if you're overweight for your body and everything, you are most likely to have a lot of episodes of high blood pressure, and your kidney, you may have heart attack, kidney damage, and a lot more. Next point is reduce your salt intake. Reduce your salt intake by 70%. Eat little or no salt. Don't say the food is tasteless. It is. Try using much or more of the stock of the food you're cooking to cook your meals than taking salt itself and putting in the food. Because salt will increase your blood pressure by 180%. No, just kidding. It will really, really provoke you to have a lot of episodes of nerve problems, high blood pressure problems. The next point is stop smoking. Stop smoking. Smoking and hypertension don't go together. You could either choose your health or a cigarette that will take your life. Most people who have high blood pressure and who smoke do not live for long, do not enjoy their health. Next point is reduce your alcohol intake. Reduce your alcohol. And if you have to take alcohol, make sure you're taking a wine that can help your body instead of taking liquor, whiskeys and the others that will not really help you. That will not really help you. Another point is stop the intake of caffeine. Caffeine plays a role in your nerves. It actually plays a part on the normal function of your nerves. A lot of people who take caffeine suffer from a lot of nerve function. I remember when I used to take a lot of caffeine, I used to notice that at some point I started shaking when I stopped taking caffeine or when I take black coffee. So I had to stop it. Stop caffeine products. And not only coffee, there are some teas like green tea. This green tea has caffeine. Stop. Lose weight by exercise and eating healthily. Avoid taking supplements or weight loss supplements. This is another point. You're taking a weight loss supplement and it may contain caffeine that may play a role in messing up your health and causing you to have an organ failure or heart attack or stroke. Try to lose weight naturally. Keep fit naturally. If you're taking a supplement to lose weight, let it be more of a detox. Because 90% of the weight loss products on the market actually contain caffeine. Because caffeine increases your metabolic rate. It helps you to be active and burn fat quickly. That is why a lot of products for weight loss contain caffeine. And also because it will make your mind sharper and all that, your brain sharper and smarter, and you can focus, but that's not what you need. You have to target exercising and taking more of natural stuff. There's green tea that has caffeine, and even some of the teas in tea bags contain caffeine. So you should do your research. Your health is priority. I hope you have been enlightened and blessed by this short teaching. And if you are a returning subscriber, I want to thank you so much for your loyalty, for watching, for sharing. I want to thank you. If you are new on this channel, please subscribe and share this to somebody that you know it may be of help to them. I remain your humble and favorite medical microbiologist, your favorite health professional, Gwendolyn Howie. Bye-bye.